Okay, so I wanted to make these videos showing some upper extremity and lower extremity bones to go over how you would identify each bone as being a left or a right side if you were to find them individually. You're going to be responsible for a couple bones in the upper extremity and a few bones in the lower extremity that I want you to be able to know as a left or a right. Normally I make my students know all of the bones as left or rights, but sometimes it's hard when you're not holding them in your hands and able to really examine them to decide if it's a left or right. But I have picked a few out that you should be able to identify in a picture as left or right, and those are the ones I'm going to go over in these two videos. If you were to find an entire upper extremity here, like we have, where you have the clavicle, you have the scapula, humerus, ulna, radius, carpals, and ham bones, you'd probably be able to pretty easily decide if it's a left or a right. You could look at just look at the hand and put it in anatomical position with the palm facing up and the thumb lateral, and you could know that that's a left shoulder or left upper extremity. But when you're faced with some individually, sometimes it can be a little bit of a challenge. And so the two bones that you're going to be familiar or need to be familiar with are the scapula and the humerus. And so I want to go over those two and show you how I would convince myself it's a left or a right. There really isn't any right or wrong way as long as you can get to the right answer. But this is just how I do it. If I were to find this bone just sitting there and I needed to know if it's a left or a right, the first thing I'm going to do with the scapula is I'm going to look at the spine. I feel like the spine of the scapula is an easy point to discover or to find pretty quickly. I know that the spine of the scapula sits superiorly. All right, you wouldn't see a scapula like that with the spine inferiorly, so I know that it sits superiorly. I also know that the spine of the scapula sits posteriorly. So if I orient this bone with the spine superior and the spine posterior, I'm almost there. I can confirm it by looking at this nice smooth subscapular surface that I know faces anteriorly on the body. So I've got superior and inferior, I've got anterior and posterior figured out. So now I need to know medial and lateral. And there's two sides here, right? Medial and lateral, or medial and lateral, we don't know yet. I find that the easiest way to do this is to look at these 3 points that we've discussed. This is the glenoid cavity, or the glenoid fossa, where the scapula articulates with the humerus to make the glenohumeral joint, or the shoulder joint. This would be lined with hyaline cartilage to make the shoulder joint. And this is the coracoid process, and this is the acromion. So I've already figured out that this is anterior, and I can confirm this by knowing, because I know the coracoid process faces anterior. And I also know that the acromion process is more posterior. So I can confirm some of the things I already knew in terms of being anterior and posterior. But I use the glenoid cavity to tell me medial and lateral, because I know that the shoulder sits lateral in the body. Right? Here's the humeral head that articulates with it, and I know that the arm is the lateralmost portion of the body, right? And so the glenoid cavity must be the lateral side. So if I set this upright with the spine superior and posterior and the glenoid cavity facing lateral, I know that this has to be a left shoulder. I could try to convince myself otherwise. I could put the glenoid lateral and try to convince myself this is a right. But that spine of the scapula being anterior proves I'm wrong and make me start over. Okay, I could try to convince myself that this is right by lining up the spine posterior and superior, but if the glenoid is facing medial, I know I'm wrong. And so this would mean this has to be a left shoulder or a left scapula. So let's look at the humerus. Okay, the humerus is another one that's pretty easy to figure out relatively quickly. Where I start is at this rounded portion, okay, which we call the humeral head, and this would be the other half of the glenohumeral joint, also lined with hyaline cartilage. And I know that the humeral head, the side that articulates with the joint, or the glenohumeral joint, is the superior end, and so I orient the superior first. So now I've got superior and inferior figured out. The next thing I do is try to identify anterior and posterior. There's a couple ways you can do this, and either one is correct. If we looked at the proximal side, you notice these two bumps, okay, or these two knobs. The larger one is the greater tubercle, the lesser one, or the smaller one, is the lesser tubercle. And then here's the intertubercular groove right there. You can remember that the greater tubercle is the one that sits lateral, and the lesser tubercle sits medial. You can also remember that the greater tubercle and the lesser tubercle both face anteriorly. So that's one way you can orient it. The other way, if we're looking at anterior and posterior, is to look at the distal epiphysis. You can start by looking at these two indentations or depressions, one here and a larger one here. The larger one is the olecranon fossa. The smaller one is the coronoid fossa. We know that the olecranon fossa faces posteriorly and the coronoid fossa faces anteriorly, and that the olecranon fossa is the deeper of the two, or the larger one. And so you can use this to orient it posterior and anterior by putting the olecranon fossa facing posterior and the coronoid fossa facing anterior. You could also use the tubercles, where the greater tubercle and the lesser tubercle are both facing anteriorly. The other way you could do this is by looking at these two joint surfaces in the distal epiphysis. Here you have the capitulum, which articulates with the radius. Here you have this groove surface, the trochlea, which articulates with the ulna. And we know that in anatomical position, these two are facing anteriorly. So that's another way to identify anterior versus posterior, where you can't even see the capitulum. So if I were to find a humerus, I would first orient by putting the head of the humerus superior, the greater tubercle lateral, and the capitulum lateral. I would face the coronoid fossa anterior and the olecranon fossa posterior. So now, by orienting it like that, I would know that this has to be a left humerus. Now I could try to convince myself that this is a right by facing the humeral head superior and facing in medial like it would. And I could convince myself that this portion would be the greater tubercle and that would be the lesser tubercle if I forgot about the intertubercular groove. But I could do that. But once I get down here, I would convince myself I was wrong, partly because I see this deep depression that I know is the olecranon fossa, and I know that it can't be anterior, it has to be posterior. And I'd confirm it by looking at the capitulum, which is now facing posterior this way, but should be facing anterior. So then I would switch it, realize I made a mistake there, and I would know that this is the left humerus. So, just two bones in the upper extremity that you'll need to know in terms of left or right. You'll need to know all the rest of them and all the points that we talked about. But in terms of left or right, just these two, scapula and the humerus.